Fewer than 1 in 4 Nova Scotia Health employees have gotten their flu shots this year. That's the lowest uptake amongst healthcare workers in at least a decade. Janet Hazelton is president of the Nova Scotia Nurses Union. Ms. Hazelton, why is it that so many healthcare workers refuse to be vaccinated?
I think I'm not so sure it's refused as much as they just haven't taken the time or taken advantage of going and getting the flu shot. I think it's has a lot to do with uh, COVID fatigue, which we all have. Vaccine fatigue, which we all have. We've gotten lots of vaccines related to COVID, and so I think trying to schedule. I have to get my COVID vaccine, and how many days do I have to wait to get my flu vaccine? It's just created a little more work for people, and I think it's not just healthcare workers. We know it's public at large are not taking the flu vaccine as they should.
For sure, the numbers bear that out, the whole community, right across the community, really. But in healthcare, people are working in the field of medicine, and top medical voices are saying, yourself included, get vaccinated against the flu. In some ways, does the poor uptake from the healthcare community actually undermine the vaccination message from the very health professionals?
In some ways, I believe it does, but I think that hopefully our more vulnerable population, like our seniors and our children and our immunosuppressed uh, residents of the province, are listening to their healthcare providers, their primary healthcare providers, and hopefully those individuals are going and getting their flu shots because they need it more than the rest of the public. We're hoping that this is just a blip and that next year we'll get back to the regular uptake of our flu shots. And we'll be working with the employers, all the unions, to see what can we do to make our healthcare workers get the flu shot. Is it taking it to them on their units, whatever hours they're working? What we need to do is make it as easy as possible for people to get their flu shot. So we need to also look to see, did COVID affect that? Were we not making the flu shot as available because of COVID? Because lots of things sort of fell off the rails when we got focused on COVID. I'm not saying it did, but I'm not so sure that it didn't.
I know the healthcare staffing levels are challenging at the best of times. How badly can the flu or COVID sickness impact the nurse staffing levels?
Quite significantly, because we know that when people get the flu, sometimes they're out for not just 24 hours, they're out for a few days. And so we can't afford to have anybody not working. Um, we need everybody working that can be working. So the flu shot is important. And it's not just important to keep you working, but it's nobody wants to be sick. Nobody wants to spend 3 or 4 days in bed. So we're hoping that this message, people may assume, I didn't get it. I'm a healthcare worker, but my neighbor did, or the nurse that I'm working with did, and so you might just assume. But these numbers are startling, and I'm hoping that this will make healthcare workers understand and realize, well, maybe I should go get the flu shot. I thought it was just me, but now we're seeing that it's more than just a person. Because I don't think anyone is opposed to getting it. I think they just haven't fit it into their schedules.
So, given all that, should flu shots just be made mandatory for healthcare workers like nurses?
No, I don't think so. I think we saw a lot of pushback with the COVID vaccine being mandatory, so much so that not so much in our province, but in some provinces, nurses actually gave up their jobs as opposed to getting the COVID vaccine. That was a state of emergency, and that had to be mandatory. I think if we make the everyday flu shot mandatory, I think we'll get a lot more pushback. If you're not going to make it mandatory for everybody, why would you just make it mandatory for healthcare workers?
As you say, the flu vaccination rates, they've been low. They've always been low, lower than some people would like, and they are dropping now, it seems. It appears that the education, and we've seen lots of television ads and so on, around the importance of getting the flu shot may not be working. So what do you do about that?
Well, I think first of all, we have to find out and understand why they're not getting it. And I don't think we have a clear understanding. Is it vaccine fatigue? Is it just fatigue? We need to understand and appreciate why. And if it's if it can be addressed, we need to address it. So if it's because, I'm not going to make an appointment and I need it to come to me on my unit, then we're going to need to do that. And we do it in some places and not so well in others. So we need to understand the reason. And if the reason is lack of education on the importance, then that's what we're going to have to do. We're going to have to educate people on how important it is to get the flu shot.
Janet Hazelton is the president of the Nova Scotia Nurses Union. Thank you for your time today.
Thank you, and hopefully all of our viewers, including healthcare workers, will get the flu shot.